Welcome to this in-depth health special on over-the-counter painkillers and their safety in older adults. Whether you're managing joint pain, arthritis, or just the occasional headache, chances are you've reached for Tylenol, Advil, or even aspirin at some point. But did you know that these common medications, while widely available, can pose serious risks as we age? In this video, we'll walk through everything you need to know about the most common painkillers: acetaminophen, NSAIDs like ibuprofen and naproxen, and aspirin, with a clear focus on what's safest for older adults. We'll explore how these drugs work, their risks, and how to use them wisely, and even look into topical pain relief cannabinoids and non-drug strategies. By the end, you'll have the knowledge to make confident, informed choices, whether you're caring for yourself or supporting an aging parent. Let's start by breaking down one of the most frequently used pain relievers in the world, acetaminophen. 1. What to know about acetaminophen Tylenol. Acetaminophen, known by the brand name Tylenol in the US and paracetamol elsewhere, is one of the most commonly used painkillers globally. It's also the most widely recommended for older adults. Why? Because when used correctly, it offers effective relief with relatively low risk, especially compared to other painkillers. Acetaminophen is not an anti-inflammatory drug. It works mainly in the brain, blocking the chemical messengers that signal pain and fever. That means it's good for headaches, muscle aches, back pain, mild arthritis, and fevers, but not inflammation-related pain like swollen joints from arthritis flare-ups. Listen to this tip. If you're taking acetaminophen regularly, track all medications, both prescription and over-the-counter, to avoid accidental overdose. Now here's the important part. The liver processes acetaminophen. Taking too much, even unintentionally, can cause severe liver damage. That's why the general daily maximum dose for adults is 3,000 milligrams. Warning: many cold, flu, and prescription medications also contain acetaminophen. Combining them without realizing it can push you over the limit. And that's when it gets dangerous. In fact, about 40% of acetaminophen overdose cases are accidental. And liver failure from overdose can happen even in people who don't drink alcohol or have pre-existing liver disease. So what's the verdict? White heavy check mark for most older adults, especially those with high blood pressure, kidney problems, or sensitive stomachs. Acetaminophen is generally the safest oral option. Just be sure to respect the daily limit, especially if you take multiple medications. 2. What to know about NSAIDs like ibuprofen and naproxen. Let's move to the next big category, NSAIDs, or non-steroidal anti-inflammatory drugs. You probably know them by names like ibuprofen, that's Advil or Motrin, and naproxen, sold as Aleve. NSAIDs are popular because they reduce both pain and inflammation, so they're often used for arthritis, muscle injuries, gout, and dental pain. And yes, they usually feel stronger than acetaminophen. But here's the catch. As effective as they are, NSAIDs are associated with several serious risks for older adults, risks that grow as we age. First, bleeding. NSAIDs can irritate the lining of the stomach and intestines. That increases the risk of gastrointestinal bleeding, which can be life-threatening. If you're already on aspirin or a blood thinner, the danger increases dramatically. Second, kidney stress. NSAIDs reduce blood flow to the kidneys, which can lead to kidney damage, especially in people with pre-existing kidney problems or those taking diuretics or ACE inhibitors. Third, heart and fluid issues. NSAIDs can raise blood pressure, worsen heart failure, and increase the risk of heart attacks or strokes, especially with regular use. Did you know? According to some estimates, NSAIDs lead to over 40,000 hospitalizations and more than 3,000 deaths per year among older Americans. So, what does this mean for everyday use? If you're an older adult or caring for one, NSAIDs should be used cautiously, if at all, and only for short-term relief. Avoid high doses, avoid daily use, and always talk to your healthcare provider if you're considering them for more than a couple of days. 3. Tylenol versus Advil or Aleve. Let's settle the common debate. Tylenol or Advil, which is better? The answer depends on your age, health conditions, and the type of pain. Tylenol is safer for daily or long-term use in older adults. It's easier on the stomach, doesn't affect kidney function as much, and has fewer cardiovascular risks. Advil or Aleve are more effective when inflammation is a major part of the problem, like an arthritis or tendinitis, but they come with much higher risks. Practical take. If you're over 65, have kidney issues, high blood pressure, or take blood thinners, Tylenol is the safer first choice. NSAIDs should only be used if Tylenol isn't effective and your doctor says it's safe. 4. What to know about aspirin. Aspirin, one of the oldest painkillers, is technically an NSAID, but it works a bit differently. Today, aspirin is no longer recommended for routine pain relief, especially in older adults. Instead, it's primarily used in low doses as a blood thinner to reduce the risk of heart attacks and strokes in people who've already had one. Why not for pain? Because even though it's effective, aspirin increases the risk of bleeding, especially gastrointestinal bleeding, and it doesn't provide significant advantages over other options. Did you know? Even baby aspirin, the 81 milligrams dose, has been reevaluated. Guidelines now suggest avoiding daily aspirin for heart disease prevention in older adults unless you've had a prior cardiovascular event. So if you're still using aspirin for pain, it might be time to reconsider. Occasional use is probably fine, but for anything more frequent, talk to your doctor about alternatives. 5. Why topical OTC painkillers are a good option. When oral medications pose too many risks, topical pain relievers can be a game changer, especially for older adults. Topical OTC painkillers, like creams, gels, and patches, are applied directly to the skin over painful areas. Some of the most common include menthol-based products like Biofreeze, capsaicin creams, salicylates like Aspirin, and now, even topical NSAIDs such as Voltaren gel. What makes them such a smart option? Because they deliver pain relief where it's needed, with minimal absorption into the bloodstream. That means lower risk to the kidneys, lower chance of stomach bleeding, minimal impact on blood pressure, and far less interaction with other medications. Tip: Voltaren diclofenac. Gel is now available without a prescription in the U.S. It's especially useful for osteoarthritis in the knees, hands, and elbows. A few words of caution. Always wash your hands after applying, avoid broken skin, and follow dosing guidelines. Even with creams, overuse can still lead to side effects over time. Bottom line, for localized joint or muscle pain, topical options are often the safest first step, especially if oral painkillers have caused problems before. 6. Tips on safer use of OTC pain meds over the counter doesn't mean risk-free, especially in older adults. Let's walk through a few safety guidelines that can make all the difference. White heavy checkmark, know your limits. For acetaminophen, no more than 3,000 milligrams per day, and ideally close to 2,000 milligrams per day if you have liver concerns or drink alcohol. For NSAIDs, never use them daily unless under medical supervision. Short-term use only, and avoid mixing them with other NSAIDs or aspirin. White heavy checkmark, check every label. OTC meds for colds, allergies, or sleep often contain hidden acetaminophen or NSAIDs. Combining them unintentionally is one of the most common overdose causes in older adults. White heavy checkmark, avoid PM formulas. Medications labeled PM often include diphenhydramine, the same ingredient in Benadryl, which is known to impair memory, cause confusion, and increase fall risk in seniors. This type of anticholinergic drug is on the Beers criteria list of medications older adults should avoid. Track everything. Keep a simple log of all meds, prescription, OTC, supplements, and review it regularly with your doctor or pharmacist. They may catch interactions you didn't realize were possible. White heavy checkmark, start low, go slow. With any new medication or dose, begin cautiously and monitor for side effects, especially fatigue, dizziness, swelling, or changes in appetite or alertness. Being proactive can prevent avoidable harm and help ensure your pain is treated without trading one problem for another. 7. What to know about cannabinoids for pain relief. As cannabis-based products become more mainstream, many older adults are asking, can medical marijuana or CBD help with pain, and is it safe? The short answer, maybe and cautiously. CBD, short for cannabidiol, is one of the non-intoxicating compounds in cannabis. It's available in oils, capsules, creams, and gummies, often marketed for pain, anxiety, and sleep. Some early research suggests that CBD may reduce inflammation and nerve-related pain. It's generally well tolerated in small doses, but not without caveats. Here's what to watch for. Drug interactions. CBD is metabolized by the liver, the same system that handles many other medications. It may interfere with blood thinners, heart meds, or seizure drugs. Unregulated quality. Many CBD products vary widely in potency and purity. Always look for third-party testing. Sedation and dizziness, especially at higher doses or in combination with other medications. Then there's THC, the part of cannabis that causes a high. While low-dose THC may help with chronic pain, especially in conditions like neuropathy, it comes with more risks: impaired balance, confusion, memory issues, increased fall risk. Practical advice: if you're curious about cannabinoids, start with topical or low-dose CBD products and talk to a healthcare provider first, especially if you're on multiple medications. While not a first-line treatment, CBD may be worth exploring for those with persistent pain who haven't found relief through other safe options. 8. Tips for pain management in general. When it comes to managing chronic or recurring pain, over-the-counter medications are just one piece of the puzzle. Many older adults experience pain that's complex, involving arthritis, neuropathy, past injuries, or muscle tension, and no single pill offers a perfect fix. So, how do we approach pain management safely and effectively? Let's look at several core strategies that can reduce pain while protecting overall health. Start with identifying the cause. Pain is a symptom, not a diagnosis. It's critical to work with your healthcare provider to uncover what's driving the discomfort, whether it's inflammation, nerve compression, arthritis, posture problems, or another condition entirely. Treating the root, not just masking it, is the only way to achieve long-term relief. White heavy checkmark try non-drug interventions. This is often the most overlooked, yet most rewarding approach. Physical therapy. A personalized movement plan can reduce stiffness, improve mobility, and even retrain pain responses. Strength training. Under supervision, light resistance exercises can reduce joint stress and build supportive muscle. Heat and cold therapy. Applying heat can relax muscles and increase circulation, while ice can reduce inflammation. Massage therapy, especially helpful for muscle tension and circulation. TENS units, small devices that use electrical impulses to block pain signals, safe, drug-free, and often effective for chronic conditions. The right lifestyle changes can reduce your reliance on medications. That means fewer side effects and better long-term control. Use medications when appropriate and reassess often. Sometimes, pain relief is necessary to allow for better movement and rest. But the key is to use medications at the lowest effective dose, for the shortest effective time, with periodic reviews to avoid overuse. Ask your provider to help you create a comprehensive pain plan, one that includes medication, physical therapies, and wellness tools tailored to your body and goals. Let's do a recap. What's safest for older adults? Let's bring it all together with a practical recap. Acetaminophen Tylenol, safest for most older adults. Watch liver dosing, no more than 3,000 milligrams per day, hidden in many cold and flu medications. NSAIDs, ibuprofen/Advil, naproxen/Aleve, powerful for inflammation, but risky for the stomach, kidneys, and heart. Avoid daily use unless advised by a doctor. Consider topical NSAIDs like Voltaren instead. Aspirin, not recommended for pain relief anymore. Still used for specific heart conditions. Increases bleeding risk with long-term use. Topical painkillers, great for localized pain. Fewer systemic side effects. Try different brands to find what works best. Cannabinoids, CBD and THC, still under study. May help in some chronic pain cases. Check for drug interactions, quality issues, and sedation risk. General pain management. Identify root causes. Use non-drug therapies, PT, exercise, massage. Keep medication used minimal and monitored. Avoid sedating PM products and unnecessary combinations. Bottom line, older adults can use painkillers safely. But the safest strategy is a custom, well-balanced plan that limits risky drugs, emphasizes lifestyle solutions, and puts safety first. 10. FAQs about OTC painkillers in older adults. Let's now answer some of the most frequently asked questions that come up in clinics, support groups, and caregiving forums. Q1. What's the strongest over-the-counter painkiller? While NSAIDs like ibuprofen or naproxen feel stronger, they also carry greater risks. Acetaminophen is safer, especially for routine use, but less powerful for inflammatory pain. If you absolutely need stronger relief, consider combining acetaminophen with a topical gel, asking about physical therapy or gentle stretching routines, using short bursts of NSAIDs with a stomach protector under supervision. Q2. Can I take Tylenol and Advil together? Yes, under careful conditions. Tylenol and Advil work differently, and in some cases, they can be alternated for more complete pain control. But this is only safe when doses are carefully timed and tracked. You're under medical supervision. You avoid exceeding daily limits for either. Q3. What's safer, ibuprofen or naproxen? Naproxen tend to last longer, but may carry a slightly higher risk of GI side effects. Both are NSAIDs and have similar risk profiles. Use the lowest effective dose for the shortest time and never mix both. Q4. What about Excedrin? Excedrin contains aspirin, acetaminophen, and caffeine. While effective for migraines, it combines multiple medications, increasing bleeding and liver risk in older adults. Avoid using it regularly or without professional input. Q5. What if nothing works? Even Tylenol or topical creams? At that point, it's time to explore prescription topical patches like lidocaine or diclofenac, referral to a pain specialist, physical therapy or pain reprocessing therapy, group pain management programs, carefully monitored use of other agents like duloxetine or low-dose opioids, but only as a last resort. Pain is manageable, but it often takes a multi-pronged approach, not just a pill. 11. A word for caregivers. If you're caring for an aging parent or partner, managing their pain safely becomes part of your daily concern. Here's how to approach it with confidence and compassion. Start with listening. Ask them to describe their pain clearly. Where is it? When does it occur? What makes it better or worse? Keep a medication chart. List every medication they're taking, including supplements, creams, and, as needed, pills. Share this with every doctor visit. Have hard conversations. If they've used NSAIDs for years or rely on aspirin for pain, it's okay to ask, what if there's a safer option now? Education can shift habits gently. Audit the medicine cabinet. Remove outdated drugs, NSAID duplicates, and anything labeled PM. Many older adults are still taking medications no longer considered safe. Caregiver tip. Ask about non-drug pain options at every appointment. If the doctor doesn't bring it up, you should. Most importantly, stay involved. Medication safety is not just about choosing the right drug. It's about building a pain care strategy that keeps your loved one mobile, mentally sharp, and independent. We've covered a lot in this video, from Tylenol to topical creams, ibuprofen to cannabinoids, and everything in between. But now it's time to bring all together. Pain may be part of aging, but suffering doesn't have to be. The key is to manage pain wisely, respectfully, and with a full understanding of what works, what doesn't, and what can cause harm over time. Here are 5 practical next steps you can take today for yourself or a loved one. Step 1. Review your medications. Look through your medicine cabinet. Check for hidden acetaminophen in cold meds, PM-labeled drugs with diphenhydramine, old prescriptions, expired NSAIDs, duplicates or confusing combinations. Tip: make a list and take a photo, then bring it to your next doctor or pharmacist visit. Step 2. Track your pain. Use a simple notebook or app to record where pain occurs, when it starts, and how long it lasts. What you were doing before it started, what helped or didn't help. This gives your provider clues to the type of pain, which helps guide safer treatments. Step 3. Ask the right questions. At your next appointment, ask, is acetaminophen still the safest option for me? What are the risks of the meds I'm using now? Are there any topical or non-drug options I should try? How often should we reevaluate my pain plan? These questions show you're proactive, and that matters. Step 4. Try non-drug tools. Pain often improves with physical movement, stretching, heat therapy, massage, or even mindfulness-based techniques. Ask about referrals for physical therapy, occupational therapy, group wellness programs, or Tai Chi for seniors. These build strength, reduce inflammation, and empower you beyond medication. Step 5. Share this video. If you found this valuable, someone else will too, whether it's a family member, church group, or senior center. Sharing this knowledge could save someone from unnecessary harm. Final thoughts. You have more control over your health than you may realize. Choosing the right pain reliever isn't just about what's on the shelf. It's about understanding your body, respecting the risks, and working with trusted professionals to find the gentlest, most effective path forward. Pain is a signal. It's the body's way of asking for attention, not just a reason to medicate. And remember, acetaminophen is often safest, but watch your total daily dose. NSAIDs can be powerful, but risky with age. Aspirin is no longer a go-to for pain. Topicals and non-drug methods often outperform pills in the long run. Knowledge is power, and now you have it. If you appreciated this video, subscribe to our channel, Senior Health Thrive. Click the bell icon for future expert videos on aging, wellness, and smart medical choices. Share this with someone you care about. Comment below what pain relief methods have worked best for you or your loved ones. We'd love to hear your experience. It may help someone else make a safer decision. Thank you for watching. Stay strong, stay informed, and take care of yourself and those you love. This is Senior Health Thrive, where smarter choices lead to healthier lives.